Do you have pain on the outside of your hip? Do you think that you might have hip bursitis? Did a doctor tell you that you have trochanteric hip bursitis? Well, in today's video, I'll be explaining 3 hip bursitis exercises that you need to start doing right away to fix this problem without having surgery, injections, or pain medications. My name is Dr. David and I'm a specialist physical therapist at Paso Manual Physical Therapy, and this channel is dedicated to helping people stay healthy, active, and mobile while avoiding an unnecessary surgery, injections, and pain medications. Please subscribe so that you don't miss out on any of the helpful videos that we post every single week. Now in today's video, I'm going to be telling you the 3 exercises that you need to be doing, and I'll also go into some exercises that you should definitely be avoiding. Often these are actually given to you by healthcare providers, but I'll explain why you shouldn't do them. Now if you want to know exactly what hip bursitis is and how it occurs, what leads up to it, I've got another video describing that. The link for that video is in the description below, so just scroll down to find that video if you want to start there first. Let's get into the exercises. The very first exercise that you need to be doing is a great one, especially if it's super irritated. If your hip bursitis problem, remember it's pain on the outside of your hip, so it's going to be right in this area. If it hurts right there, this is a great exercise. It's easy to do and will help tremendously. So I'm going to show you my butt, not with clothes on, of course. You're going to stand with your feet turned outwards a comfortable amount. So just make sure that your feet are not pointing straight ahead and not way too far turned out, but kind of in between. You do need to probably adjust them a bit more outwards than you normally stand though. Once you stand like that, then you're gonna do some butt squeezes. I'll show you what that looks like. So I'm standing with my feet out. Then all you're gonna do is tension up these butt muscles, squeeze them pretty hard, and hold it for 10 seconds. And you just wanna get these muscles stiff and tight, get them to tighten up really, really good. In case you get any cramping, then lighten up on how hard you tighten. And if it hurts the outside of your hip, play with that foot position. Generally, the more out you turn, the better it will be. Now, if you're hurting no matter what, if your hip bursitis, the outside of your hip is bothering you, even though you've tried different positions, then you're severely irritated. You've probably got a very far gone problem. My recommendation to you is do this exercise a lot lighter, so lessen the intensity. In other words, if squeezing as hard as you can is 100%, play with the percentages. See if you can just squeeze like 10%, 20%, and see what you can tolerate without increasing that hip pain. Now, if you're not that flared up, then I want you to go 100%. And you're gonna squeeze it 10 times. And each time you squeeze it, hold for at least 10 seconds. Generally not more than 30 seconds is necessary. You get diminishing returns, meaning it's not gonna help you that much more to hold that much longer. But minimum 10 seconds, and see if you can work your way up to 20 to 30 seconds and do it 10 times, 10 repetitions. So just to show you one more time here, you're standing with your feet turned out, and then you're just gonna tighten up pretty good back here. Make sure both cheeks are squeezing pretty hard, and then after 10 seconds, let it go, and then you're just gonna repeat squeezing your butt cheeks 10 seconds, and then let it go, and then tighten up again. And just repeating that, what you should feel is your butt muscles are gonna get quite tired. And that's the whole point. The reason for this is because we're trying to fix a muscle imbalance, and usually the glutes are very weak. And so you need your butt muscles to get tired, to get fatigued. Now you want to do this exercise quite often, especially if you're on the more irritated side, if it's more painful. You're looking at possibly doing this every hour, holding it for 10 seconds at a time, and do 10 reps. If you feel that you can get better just doing it a few times a day, like 3 or 4 times a day, then that might work for you. But I would play with the number of repetitions that you can do each day to get this to calm down. Now the next exercise that I'm going to show you are going to be some that you're going to do less frequently. You won't be doing these all day long, but you should start doing these at least once a day, if not 2 or 3 times a day, just to get those glute muscles nice and strong, to take the pressure off the outside of your hip where the bursitis problem is happening. So you're gonna need to lie down on the floor or on your bed. I'm just gonna put this as a pillow for me here. This is a clamshell exercise, and this is commonly done wrong, which I'll show you how in a minute. Let me show you how to do it right first. So you're gonna lie on your side, hips bent a bit, knees bent a bit. I know that this might bother your hip problem, so if you have to just lie on one side, lie on the side that you can tolerate better. So hopefully it's the side, your good side, but let's pretend my bursitis problem is right here.
So I want the bursitis on the upside. Then what I'm gonna do with my upper body is roll forward a bit so that my knee here sticks out forward, but I'm still keeping my feet even. I'm not shifting my feet off of each other like this. You gotta keep your feet kind of even as you roll over. Then once you're holding in this position, you're gonna lift up your knee just a bit and hold it for 10 seconds. What's important here is that you do not irritate the bursitis problem. If you feel it getting worse, either it's really bad, it's irritated, or you're doing this wrong. Let's check to see that you're doing it right first. What you should feel is the back, the butt muscle, the same one that you felt when you're doing the glute holds, the squeezes. That should be working. Not all of it, but a good piece of it. If you don't feel it, you feel like it's more here that's working and it's setting off your trochanteric bursitis problem, then you've got to roll forward even more. So in order to do that, you might have to straighten out your legs subtly, just like so, and then roll over quite a bit here. I'm still keeping my feet even, and then pick up. And now I feel it better targeted back in here. Hold for 10 seconds, and then relax. And you're gonna do 10 reps, kind of like the other exercise, but like I said, this one doesn't need to be as frequent. Now you might do it every hour if you find that you can and it's not bothering you, that's fine. But what I typically find is patients need to do this one 3 to 4 times a day, sometimes up to 5 or 6 times a day. And that's enough to strengthen the glutes, to fix the muscle imbalance at the beginning, enough to get it, the bursitis problem to calm down. And if you can tolerate doing this on both sides, then you definitely want to do it on both sides. But if at the beginning all you can tolerate is a side that you can lie on comfortably, then start with that. Let me cover the third exercise that you need to be doing. I'll cover the wrong ways to do the clams in a minute. But the third exercise that you need to be doing to fix this bursitis problem is bridges. It is also a glute exercise, but you have to do it in a way that makes your butt muscles fire quite a bit while keeping your quads and the front of your hips relaxed. So for this, you'll have to lie down on the floor again or the bed with your knees bent. So just like so. Then from this position, what you're gonna do is push your back flat. So as if I had my hand back here, you could put your hand back there. Just smash your back down against your hand. And when you do that, you should feel your abs tighten up a bit on the front. That's good. You need to start with that. Then once you have your abs working because you're pushing your back flat, next you want to squeeze your butt muscles while still keeping your back flat and abs tight. You should already feel this working back here, maybe even a tiny bit of a stretch up here. Then you're gonna lift just a bit and hold it right there for 10 seconds. One more thing I want you to add, I almost forgot. You're gonna open your knees a bit, just like that. So I'm opening up my knees. Then hold for 10 seconds. After 10 seconds, you can relax. Just to review this, you're gonna push your back flat, squeeze the butt muscles, open the knees, and then lift just a bit. Most people think, well, lifting higher is better, but what you'll feel if you try that is you'll feel a big stretch through here, and that actually will engage those muscles as you keep going and work against you. It'll feed into that bursitis problem. So you don't want to lift real high. You don't want to get a big stretch here. It's okay if you feel a tiny stretch. To put it on a number scale for you, just to make it simple, if 0 to 10 is the scale we're using, 0 is no stretch at all, and 10 is you're about to hurt yourself because you're stretching so hard. Don't pass about a 2 or a 3 stretch intensity on here. Once you get 3, 4, 5 and beyond, you're stretching too much. Don't go so high. You might not even lift off the bed or the floor wherever you're doing this. You might even just push your back flat, squeeze your butt, and already feel a 2 stretch. Hang out there, that's totally fine. As you get stronger, you'll be able to maybe lift a bit without feeling more stretching through your quads to the front of the hips and the thighs in here. So 10-second holds, 10 times, and do this one along with the clams about 3 times per day, spread out. If you find that it benefits you and you feel like you're getting better, even better from doing more reps, then do so. Do 4, 5, 6 sets in a day so that you can squeeze these glute muscles and get them tired. So one more time here, back flat, butt tight. If you can, open your knees first, and then if you can, lift up just a bit. Another version that I say so that it's easier to remember is gut, butt, up. So suck in your gut, that makes you flatten out your back, squeeze your butt, and then open your knees, and then up, lift up. Gut, butt, open your knees, and then up. 10-second holds 10 times. You can hold for longer, by the way, just like with the butt squeezes and the clams too. You can do that. You can hold for 10, 20, 30 seconds. After 30 seconds, you get diminishing returns. All right, so those are the 3 exercises that you need to be doing daily right now, and that should diminish the trochanteric bursitis pain. It should calm down the inflammation in the bursa and begin to fix the muscle imbalance that I've described in that other video. Check it out in the descriptions. In the description below, that should begin to fix that muscle imbalance over time. Now, this is not a quick relief thing. This is not an instant fix, short-term fix problem, short-term fix solution. This is a long-term fix solution. You've got to stick with these exercises over time. Give it a few weeks and you should see a massive reduction in your trochanteric bursitis pain, as well as good long-term relief. It should last for a good while. This is a great beginning set of exercises to do. I recommend doing more intense butt exercises as you are able to tolerate it more. And there's more videos for that. You can check out our channel for that. Please subscribe if you haven't subscribed. But let me tell you 3 exercises that you absolutely should avoid so that you don't feed into the problem and make your bursitis problem stay there longer than it should, or worse than it already is. The first one is clams. Clams done wrong. Now, I showed you the version of clams that you need to be doing. You should feel the back, almost the side and the back of your butt working. So when you do the clams the way I showed you, you should feel the muscle that's about where your back pocket is right here burning. What you shouldn't feel is the muscle where your front pocket is. So just to show you what I mean on the clam, I told you to roll forward here so that this knee sticks out. And when you come up, you should feel it in that back pocket area. The muscle should be working right there. I do not want you to feel it right here because then you're going to be feeding into the problem. So the way that people get this to work is they won't roll forward enough. They'll stay where they're at, or they'll even roll backwards, or they'll open their knee really wide, which causes their hips to turn and fire this muscle. If you feel like the front pocket muscle's working, it's called the TFL muscle, tensor fascia lata, then you're in trouble. You're going to make the problem worse over time. And it's a bit misleading because you feel the muscle working and you're getting a workout, and your physical therapist or your trainer or whoever's helping you out with your bursitis problem, maybe you're doing this at home on your own, they are telling you, good job, you're feeling the burn, but you're burning the wrong muscle, and you may not feel more pain in the moments, but later on in the day, as the week goes by, as the days go by, the problem doesn't fully go away, and it's getting worse, in fact, and setting you up for worse things like arthritis and tears and a bunch of other issues that you do not want to be dealing with. The second thing that you should avoid, I'm going to give you 3, is an abduction machine. Now, everybody knows this machine. You see it at the big gyms that have all the big machines, and it's the one where you sit in it and you push your legs out, and it typically picks up some weights. It's kind of like a clam, but you're sitting and you're moving both legs at the same time. The same concept applies here. If you're feeling the front pocket muscles working quite a bit when you're doing that abduction machine, then you're feeding into the problem. It's quite hard to get your butt muscles to work in that machine, depending on your genetics. Some people can get it to work very well. It just depends on the shape of their hips and legs. But most people, I'd say 6 to 7 out of 10, tend to work their front pocket muscles, their TFL muscles, instead of the glute muscles, and they then feed into the bursitis problem. And so the abduction machine is a bad thing to do. So I would just avoid it at all costs, honestly. If you find that you can use it successfully and truly work out your butt muscles without working the TFL, the front pocket muscles, then you might be okay. I'm not saying that it's 100% evil, but if we're talking in generalizations, I mean, I'm talking to you over a YouTube video here. I haven't met you in person probably, so I'm giving you the best advice that I can over the internet here. Now, the third exercise that you should avoid mostly is TheraBand exercises. So that's where you have those rubber bands. Usually they're kind of flat and broad, and you put them around your thigh. And some people will do squats with them, or they'll do that clamshell exercise with the band around their thighs. I don't even have any here in the clinic because we just never use them. They're rarely good. And let me tell you when they're good.
they truly do provide a lot of resistance. And if you're healthy, if you're not dealing with a problem currently, then they're good to use, just like weights. Of course, they don't work exactly like weights, but they're providing resistance against your muscles, and they can be a beneficial thing for you if you're healthy. But if you're dealing with a problem like bursitis today, and you're trying to do an exercise that you saw on the internet, or you were coached by a therapist or a trainer or some healthcare professional that told you to use these TheraBands to do your hip exercises for your bursitis problem, chances are you're going to make the problem worse. So what I find with any type of TheraBand exercise, because we get people coming in with hip bursitis that have purchased bands and done exercises their doctor gave them, or that they found on YouTube or somewhere on the internet, or they were given to, or exercises that were given to them by another physical therapist that they've continued to do, even though they didn't work, but that's all they know to do. They just aren't done well. Usually it's too much resistance. It's just challenging to do. The exercises that I gave you today are hands down the best place to start. You've got to start firing your butt muscles and avoid firing those front hip muscles, like where the front pocket is. Now, one more bonus thing that I want you to take away from this talk today is the way that you move is a big deal. And I've got a video that talks about how to walk using your butt muscles, and I want you to go check out that video. It's linked in the description below. It'll be at the way top of the description. It's about knee pain, but it pertains to this bursitis problem. What you've got to realize about hip bursitis is the TFL muscle, that front pocket muscle, sends a big long band into the knee, so it often will create knee pain as well. And so this video that I've made for you that talks about how to help knee pain with walking very much applies to bursitis. So I want you to go check out that video and learn how to walk like I've described in that video. You'll find that it's very similar to what I've taught here. It's just the next steps so that you can better fix this problem. If you can do these 3 exercises from this video at the beginning of the video, plus the walking like I'm telling you, and avoid the exercises that I covered just a few seconds ago, then you should be on your way to fixing this bursitis problem for good, for the long term. Guys, I hope this video was helpful for you. Please drop a comment if you have any questions, and I hope to see you in the next one real soon. Bye-bye.